guys. I have want to let you know how to stay safe now that the ban has been lifted. Like, we all have been sheltering in place for months now, and it's been very challenging. The children have been at home. If you have children, you've had, your mates at home, you're trying to work from home. Some of you all might be working part-time or been furloughed. So it's a very, very stressful timing. This is unprecedented times, not just from a psychosocial standpoint and a medical standpoint, but also a financial standpoint. So I want to really just send some information out on how we can stay safe now that this ban has been lifted. One of the main things that I have seen is just getting more clarity on you don't want to see my furniture, getting more clarity on the whole issue of wearing masks. Now, the CDC guidelines came out and shifted April 24th, whereas before we were advised not to wear masks unless we were symptomatic, or if we were in a setting where we were concerned about respiratory droplets, etc. But now the recommendation is, even if you feel that you have not been infected and you haven't been around COVID-19 people, to still wear the mask. But the bottom line is we have to know when it's appropriate to wear the mask and when it's not appropriate. And also the whole issue of gloves. So in terms of the mask, we'll start there. We appreciate everyone helping to flatten the curve by wearing your mask when you cannot maintain social distancing of 6 feet, or if you're in a closed-in setting like an elevator and there are people on the elevator, or you're running errands, and although you're maintaining 6 feet, it's pretty crowded, it's super important that you wear the mask. Now, when is it important not to wear masks? It is, I have seen a lot of people out driving with masks on, and again, we definitely appreciate everyone being very vigilant about wearing the mask. But the thing about the covering of the face for a prolonged period of time is that you can have an accumulation of CO2. Like, we breathe in oxygen, but we breathe out toxic CO2. And so when you have that in a contained space, like your mask, for a prolonged period of time, that can be problematic. We've seen patients in car accidents because they've literally passed out or have had accidents because prolonged CO2 accumulation can cause confusion, dizziness, fatigue, etc. The other place where it's not appropriate to wear the mask is if you are at home. If you're at home and you're either sheltered in place or not, but with your family and loved ones and they have not been infected, you don't have to wear your mask while at home. Also, when you are going to bed at night, it's important that you not wear your mask. Again, the accumulation of CO2 can be very problematic overnight. And also in the gym. So gyms have opened back up, and people have been encouraged to wear their masks when they're in settings like a gym, which typically would make sense. But if you have on a mask and you are on a treadmill, you are accumulating CO2 that can be very, very dangerous for your health if you get dizzy or if you have fatigue while working out in a gym setting with the mask on. And so if you do work out, and of course we all want to stay healthy. I know I and many people packed on what I call Corona calories. You want to get out in the sun. You want to be out in the fresh air, getting your exercise. If you are in a crowded space, I know I've gone to some parks recently and it almost looks like a festival. You just want to make sure you're in a park where you can maintain the social distancing. That way you don't have to wear your mask while running. If it is crowded, I do recommend you wear your mask while running, because the person in front of you can have respiratory droplets that can venture back if it's pretty close. Now, if you're more than 6 feet away and can maintain a healthy distance, then it's not necessary. Again, it can be very problematic. So in terms of how to properly wear a mask, I've seen some beautiful masks out there. Mine is like the boring hospital mask. But you can adjust your nose here, and then you tie it at the top first. Now, I've been wearing masks for 17, 18 years, so I'm really a pro at it. But I really feel bad for people that all of a sudden are expected to be these mask experts and like nearly suffocate themselves with the goal of flattening the curve. So you tie it at the top first, then at the bottom. The reason why you do that is because you want to be able to take your mask off easily. And so again, I've been wearing masks forever. There, you can just pull it and it'll come loose. but you keep it at the neck. That way, as you're running your errands, you can always just pop it back on. If you take it completely off, you may forget. And I've seen in some places they won't even let you in unless you have a mask on. There's like a mask police at some of these establishments. And again, we're just trying to do what we can to help flatten the curve. So I say that in jest, but if you in a facility where they require a mask, just make sure you keep it around your neck. And just remember, when you get in the car, take your mask off, or you just untie it by pulling that string so that you're not driving around with the mask on in the vehicle. And also when you're at home and when you're sleeping and when you're working out. Some people are very vigilant about wearing masks that they're concerned about other people wearing masks. So I do want to discourage the viewers from confronting people when they don't have on a mask. It's just because everyone is somewhat tense. It's an unprecedented time where people are under a lot of psychosocial stresses. You just don't know where people are mentally and emotionally and financially. So, this is just an aside. Just avoid confronting people if they don't have on a mask. If they don't have on a mask, you just avoid that person. You keep things moving and going about your day. In terms of psychosocial stressors, we've seen a huge increase in the hospital with domestic violence, increased anxiety, increased depression, because in our efforts to flatten the curve, we've kind of flattened our emotions and our affects and our mood. So it's super important that you check on your loved ones and your friends. You can do, video calls, you can do your cocktail hour, you can just do a chat with water, whatever your preference is, but you really want to make sure that you are getting some human contact with your friends and family, both near and far, with video chat if you can. Again, it's just super important that we help to educate in the medical community. We usually fear we don't understand, so my goal is to always just keep you informed. Make sure you're asking questions as you're posting your waves. I love to take questions in real time because this is really about you guys. Like I want everyone to stay happy and healthy and safe, not just during COVID-19, but beyond. So we don't know it all in the medical community. This is an ever evolving pandemic, and although we've had some wonderful strides, there's still been some spikes here nationally and globally. And again, we're making up as we go along. And so as we get information, we use that data to come up with guidelines and use that information. By the time we have guidelines, it's usually delayed. And so as I get updates, I'll make sure I check in with our Global Breast Health and Wellness Center family to make sure you guys are happy and healthy and safe. And if you have questions about what to do, what not to do, make sure you weigh in on that as well. I did a Facebook Live earlier, and one really good question that I got there was, what is the benefit to sheltering in place, or can sheltering in place be problematic in terms of our immune system? And that's a great question. It can be problematic for a prolonged period of time in terms of our immune system because we are naturally designed to be exposed to bacteria, to viruses. It keeps our immune system strong. And when you shelter in place for a prolonged period of time, or you're avoiding exposure to other people and the environment, actually can compromise your immune system, where it's going to make it more difficult once you are out and about full swing to fight off diseases, bacteria, and viruses, etc. So you want to kind of have a balance in terms of how much sheltering in place you do. And when you go out, just make sure you wash your hands and avoid the T-zone. And so the T-zone, hi Reverend Hill, the T-zone are the eyes, nose, and mouth. So just try to avoid touching the face as much as possible. And when you are out, once you get home, just go ahead and wash your hands. If you are in a setting where you're exposed to people either at work or socially for a prolonged period of time, you have to decontaminate yourself. Like, for example, when I come home and I've been around patients who are in a hospital setting, I take everything off and just make sure I wash that separately. If you are in an industry where you are in retail, or if you are if you're in retail, or if you are work in a grocery store or a post office, just frequent contact, it's important that you decontaminate once you get home. Just put those clothes aside, wash your hands, avoid touching your eyes, nose, and face. Now, Touche wants to know that she's traveling for a funeral, and how can she be safe while traveling. How can she do this so that she can reduce her risk of COVID exposure? That's a great question. A lot of the things that the airlines are doing is that they're not allowing that middle seat to be occupied. So just make sure that if you are on an airline where they do have a middle seat, that you choose a seat on the window or the aisle. Also, make sure you bring your hand sanitizer, because you may not have direct access to soap and water immediately. So have your hand sanitizer, and also wear your mask, and make sure that you vent your mask. And I showed my Facebook family how to do that, because we accumulate CO2, and CO2 is a gas, and it can be problematic when you wear it prolonged. So again, you tie it at the top. And if you don't have the mask that already has a vent, you could just do this. This is not going to increase your exposure. This is not going to compromise your exposing anyone else to your respiratory droplets just by venting it on the side. I hope that answered your question, and thanks for asking that. Serenity 1908, I won't hold it against you, I'm just teasing, wants to know what my thoughts are about children returning to school in the fall, especially for teachers. And we, again, are actively watching that situation. There are some conversations about having a modified schedule going back in the fall, because there are some concerns that there will be another spike in COVID-19 in the fall. And it behaves like most viruses, in that we do see spikes in the fall and winter, and it dissipates in the spring and summer. And so it's no different. So what we're going to have to do is, again, just engage in very aggressive hand washing. And in terms of the teachers, what each county may do, whether public or private, is have some sort of modified schedule. Maybe they'll be going to school every other day or doing video in between. I'm not quite sure, but it's a real concern for everyone. In the meantime, in terms of the fall, we'll just have to hurry up and wait and see. But just be prepared that it will definitely be different than last fall in some shape, form, or fashion. They're going to have to reconfigure the classrooms for the teachers and for the students so that there can be distancing in the desks. They're going to have lots of course, hand sanitizers. They're likely going to require the students to bring their own hand sanitizer. Any student that has a fever absolutely will not be allowed in to the school. Parents and teachers alike. So again, there are going to be a lot of parameters that we have not had to deal with. So we're making it up as we go along, as information becomes available, to make sure that we're all safe. But yeah, so just stay tuned for the fall. If I get any information on while I'm a part of these task force, I'll make sure I share that with our Instagram family so that you can stay abreast and be ahead of the curve in preparing for children to go back to school. Another question I've gotten is, if the camps are going to be in session. A lot of camps have canceled. You're welcome, Serenity. A lot of camps have canceled, or they have a modified camp schedule. So just be prepared. For those of you all who have small children that you're the primary caregiver of, or your children of your own, that you're going to have to make some likely alternative plans for summer. So again, that could be stressful within of itself, to just try to figure out, okay, what do we do with the children this summer if they're not able to be in camp? How can they still be happy and healthy and active at home? One of the things that I have found helpful with my children is I have them do like their own video chats via FaceTime or Zoom with their friends on a scheduled basis, or have one or two friends, so that we can make sure that they're maintaining safety, but also getting socialization. Because it could be, we're flattening the curve, but we're also flattening ourselves from a psychosocial standpoint, because we've seen an increase in depression and anxiety. So socialization in a safe way is absolutely essential. Tyrell, wonderful question. He says he feels the virus is morphing and causing new or different symptoms. That is the nature of viruses. Tyrell, and I'm glad you brought that up. That's what makes it so challenging to have a vaccine right away. Do not expect a vaccine within the next couple of weeks that's effective. That's not going to be our reality. So it's going to take some time, because viruses mutate, and that's what makes them so clever. And so in the meantime, we've just got to, wash our hands, avoid the T-zone, eyes, nose, and mouth in terms of touching the face. In terms of the new symptoms, here's the thing, Tyrell. We in the medical community, it's our job to make sure we are observing and documenting symptoms. So as we start to see symptoms, we report them. So we're learning and it's evolving as we're going. So some of the newer symptoms we've seen is not just cough, but loss of taste and smell, but also COVID toes. I'm not sure if you've heard of that, but for whatever reason, it causes the body's digits like the fingers and toes and the body in general to be hypercoagulable, so to clot very easily. And so these clots are forming that are obstructing the small vessels, causing these little purple or reddish splotches on the fingers and toes. We've even had patients where we've had to amputate because they've been so hypercoagulable in their extremities that we were not able to give them blood thinners to reverse that. So that has been a symptom that we've seen. That's a fairly new symptom that we weren't really aware of very early on. The main thing we were aware of very early on is just the chronic cough and the fever, but the loss of taste and smell and the clotting of the digits has been a fairly newer symptom. So just be mindful of that. In terms of, I had a question about if you have like multiple medical conditions like diabetes, high blood pressure, cancers, are you more likely to have COVID-19, and how can you protect yourself and shelter? You can't shelter in place forever, and these conditions are pre-existing, so they're still going to be there. The main thing with that is just to make sure you have a buddy, be it a family member or a friend, that's reliable, that can help run errands for you. If you don't, it's important that you make sure you go out with your mask and make sure you wash your hands. And I cannot emphasize enough to defer wearing your mask while driving. Again, that could be very problematic. Some people simply forget, others just don't know. So that's why it's so important that I make sure I keep our team informed on it. Now, Touche wants to know, have you heard whether or not if you have had COVID before, can you get it again? The jury is still out on that. What we're seeing, to Tyrell's point, is that viruses, they mutate. So although you may have immunity in terms of having antibodies, it doesn't necessarily mean that you will not get exposed to a different or another strand of COVID-19. I mean, we're in COVID-19 now, but we may have a COVID-20 here in a couple of months. So just make sure that again, regardless of your level of exposure, that you are engaging in proper hygiene and not hysteria, and the appropriate use of your mask. The other thing, again, that's super important is to make sure you keep your immune system strong by going out. The ban has been lifted, and we've had both camps. Some people say, okay, the governor has lifted the bans too soon. Others have said, it's not soon enough. But you just have to make sure that you are mindful of getting out when you can, but in a safe way. Some people want to know, do you need to wear gloves? Like, what's the verdict on that? So there is not a national or global or federal mandate or recommendation regarding gloves. What we do, as there are masks, but what we do know is that when you wear gloves, you can cross-contaminate, and it's also sometimes more difficult to maintain hygiene with gloves on because you're touching things and you're going about your day and touching other things. So the glove wearing is really more problematic than it is helpful, or more harmful than it is helpful. So the best thing is to make sure that you just wash your hands and avoid touching the face. Now, Dr. Kelly wants to know, in regard to your mammogram, should you wait, should you delay? Now, one of the challenging things I've seen on the clinical side is that all surgeries were canceled where death was not imminent within 24 hours, including breast. One of the things that I'm recommending women is, if you are symptomatic, meaning you feel a lump in your breast, or you feel there's been a change with the skin or any nipple discharge, just make sure you go ahead and get your diagnostic mammograms. Your screening mammograms can be delayed safely if you don't currently have symptoms. Now, TM Free 13, great question. She says, is it true that vitamin D can help protect you from COVID-19? Are there any other known things that can help you fight it off? Vitamin D within of itself doesn't can prevent you from getting COVID-19, but it's a wonderful vitamin that helps the body's immune system work better. But the thing about vitamin D is that whether you take it by pill or food, it is not effective unless you are in the sun. So the sun converts its active form, inactive to an active form. So vitamin D is only helpful when it is is most helpful when you are getting sun. So that's why it's so important that you all get out, get some exercise. When you're in the gym setting, again, I would recommend you just working out either at home or outside, because it can be very problematic with accumulation of CO2 in your mass. So I hope that answered your question. Let's see, we have another question regarding what and how do you manage, like if you have multiple medical conditions, and when do you go see your primary care doctor? Now, a lot of clinics have modified hours. I know our clinic is 2 days a week, 2.5 days a week now. So we also have modified hours in the interest of safety. But if you are having any difficulty with your management of your diabetes, your blood pressure, it is imperative that cannot wait. Screening mammograms, yes. Diagnostic, no. But also with pre-existing medical conditions, you've got to make sure that you get in and see your healthcare provider. What we are seeing, and what I'm seeing when I go into the hospital to operate, is not like a lot of COVID patients. That has started to decline. What I'm seeing is patients that are coming into the emergency room, guys, with stroke level blood pressure. I mean, I had a patient just the other week that had a stroke because she had blood pressure that was not managed, simply because she couldn't get in to see her primary care doctor. We're seeing an overabundance of people with diabetic complications coming in with like coma, almost in a diabetic coma, because the blood sugars are either too high or too low. So it's very important, again, that if you need help managing that, to make sure those are appointments that you don't skip. Most offices, including my own, they have a protocol where you go in one person at a time with your mask, a touch-free check-in and check-out, and they are asking that your loved ones stay at home or stay in the car so you can still be safe. So I want to encourage you to make sure you get out and see your healthcare provider. Now, someone mentioned, what about, Dr. Kelly, thank you. She's asking, what about telehealth? You're absolutely right. Thank you for bringing that up. I've been doing telemedicine. A lot of my colleagues have been doing telemedicine, so we can make ourselves available to patients just to have that face-to-face interaction for any overly concerning conditions. A lot of clinicians are able to call in medications if you need your diabetes medication refilled, or your asthma pump, or your medication for your COPD, your heart, etc. So there's certain things that cannot wait. And it's actually more problematic when you show up to the emergency room for your primary care. It's decreased resources, and also there are not as many clinicians oftentimes in the emergency room because they are in other areas of the hospital trying to respond to COVID-19 and also progression of diseases. So it could be very risky even just going to an emergency room setting versus just seeing your primary care doctor and being proactive to avoid that urgent or emergent situation. Now, what things whereby you shouldn't have a telemedicine visit or a primary care visit, if you have an elevated fever that you can't break with your regular Tylenol or Motrin, if you have any dizziness or confusion that's outside of your norm, if you are having any issues with taking your blood pressure and it's excessively high or excessively low, also any chest pain or any shortness of breath, those are the things that you absolutely unequivocally need to visit the emergency room for. But many things can still be managed via telemedicine or visit to your primary care doctor without, unfortunately, your loved ones being there, just in the interest of safety. Now, someone wanted to know, what are the things that they can do in terms of like just staying healthy at home? We talked about with people not being at home, but being home often and not being able to be out. Is I've been encouraging people to make sure you have lots of like aloe vera. I know it's like so off the cuff, but it's really good to keep the skin moisturized and tight. And you just do an aloe vera plant. I think most are like $5 in the grocery store. You cut it, and I usually keep it in the refrigerator. You don't have to, because it's cold and it will help vasoconstrict or close the pores, so the skin will be tight and glowy, and any residual left over, make sure you put it on your neck and also the surface of your hands, because we all are doing a lot of hand washing, so you want to keep your hands well moisturized. You're washing your face more frequently because we're all trying to be safe, but you want to make sure you stay moisturized and stay make sure your skin is healthy as well. If there's any other questions, yeah, Dr. Kelly is loving the aloe vera plant. Make sure you post those so that I can assure you that if I don't know the answer, I'll get it to you in real time. Those that I know the answer on, those that I don't, I'll make sure I consult with my colleagues and get the information to you as quickly and as accurately as possible. But I thank you guys for tuning in. This has been great. I'll definitely try to do this more often. If there isn't any takeaway from this, wear your mask when appropriate when you can't maintain your 6 feet of social distancing. But the main thing is to make sure that you don't wear your mask while driving. One, you don't have to wear your mask when you are in the home or when you're sleeping or resting at night. And also, if you see that people aren't wearing masks, you don't necessarily have to confront them about it. You just avoid those people. Because people are under, it's like a pressure cooker situation for a lot of people. So just make sure you all stay safe, check in on each other, have your face-to-face interaction via your video conferences. But I want you guys to stay happy and healthy and whole during COVID-19 and beyond. So please post your questions so that I can do this again. I thank you all for tuning in. Share it if you feel it'll be helpful for someone. But most importantly, just try to encourage people to avoid wearing their masks while driving. And yeah, you guys stay safe. I love you guys, and I can't wait till this is over so we can all just give each other a big hug and get out there and just have a good time and love each other more, be more patient, more kind, and more patient and kind to ourselves. So until next time, you all take care, and don't forget to post your questions and share. And I hiked Stone Mountain in a mask and almost died. I'm certain of it because that's the CO2 accumulating in the mask. So again, just vent your mask. And if you're climbing Stone Mountain and you're not around a lot of people, you can actually take your mask off or just have it around your neck. When you're in higher altitude, you already have less oxygen. So if you have low oxygen and low CO2, that's like a really big problem waiting to happen. So just make sure the next time you climb, if you can safely do it without your mask, I say go for it. And if people start to come around and it gets a little crowded, you just put it back on and tie it up at the top. So nonetheless, again, this has been so amazing. I always enjoy these live discussions, and don't forget to post so that I'll know what's important to you, and I'll make sure that your questions get answered. So anyway, be good to each other, be good to yourselves, and of course we're gonna treat it, beat it, move on, whether it's cancer or COVID-19. I'll see you guys next time. Bye.